Hello, I'm Jonathan Nelson with the Texas Academy of Family Physicians, and this is your Capitol Report. Less than a week remains in the 82nd Texas Legislature, and while there are still a few pieces of the budget puzzle that have to be put in place, a deal has been struck that would spend $80.6 billion over the next 2 years in state funding. Physician fees would not be cut in Medicaid and CHIP, but the budget doesn't account for the inevitable caseload growth in these programs, leading officials to project a significant shortfall for the next legislature. Medical schools would have about $400 million less in state funding under the budget deal. That includes a cut of about 20% in graduate medical education formula funding. Lawmakers have decided to remove all funding for the statewide primary care preceptorship program and to cut funds for the physician education loan repayment program by 76%. For the current biennium, the state budgeted $26.8 million to support residency training for primary care physicians. But the current budget deal slashes that funding by 79%, leaving just $5.6 million for family medicine residency programs. Under the House's original budget, that funding would have been removed altogether. A decision TAFP Treasurer Troy Fessinger says would mean fewer residents would be training at his program, the Memorial Family Medicine Residency Program in Sugar Land.
So it could have a huge impact on our program. We could go from training 14 family physicians every year to 11 overnight. You take a smaller program where it's a bigger piece of their funding, they could go from 6 to 3 residents, they could go from 6 to none if the program's financing is precarious and they fold. So it could easily have a devastating effect on the program.
3 bills aimed at granting independent practice to nurse practitioners have failed to meet the deadline for debate in the House, thanks in large part to the work of TAFP members and our partners in organized medicine. TAFP member Tricia Elliott testified against the bills at a hearing in mid-April. She told members of the House Public Health Committee that while there is little research comparing the quality and the cost-effectiveness of care provided by nurse practitioners to that of family physicians, the differences in their education and clinical training are starkly evident.
During their education, a nurse practitioner experiences between 500 and 1,500 hours of clinical training, about the same as a third-year medical student. I also teach medical students, and I have third-year and I have fourth-year students who work with me directly in the clinic. In my 12 years, I can attest that in no way are medical students at this level of training capable and prepared to see patients independently and unsupervised by a licensed physician.
Throughout the session, TAFP has been working on a number of public health measures. For an update on these, here's TAFP's Kate Alfano.
TAFP and our partners in the Texas Public Health Coalition are tracking bills that aim to promote healthy eating and exercise, immunizations, tobacco cessation, and cancer prevention. However, as is the case with most bills this session, public health initiatives rely on state funds, and gains made in previous sessions are at risk of cuts. This was the case with House Bill 400 by Representative Rob Eisler of the Woodlands. It would have repealed school fitness requirements and health education as a means to cut spending in public schools. But in practice, it would essentially gut programs aimed at curbing Texas's obesity epidemic. Carrie Kroll, chair of the Partnership for a Healthy Texas, says we dodged a public health setback when this bill died because of House deadlines.
It is a positive that House Bill 400 was pulled from the calendar. That language is likely to show up again in one of the 2 fiscal matter bills that have to pass in order for there to be enough revenue for the actual state budget to pass. And so we're going to be in a position again to try and stave off amendments that would be harmful to public health, specifically children's.
Once facing an uncertain future, a bill that would ban smoking in bars, restaurants, and most public places was added to a bigger revenue bill and has passed the House. House Bill 670 by Representative Myra Crownover of Denton not only protects Texans from secondhand smoke. The bill's fiscal note says it could save $31 million in state Medicaid costs over the next biennium. To pass, it must survive the final negotiating process for Senate Bill 1811. One bill supported by the Public Health Coalition has already passed both chambers. Senate Bill 1107 by Senator Wendy Davis of Fort Worth requires students entering college to receive a bacterial meningitis vaccination. The CDC identifies teens and young adults ages 16 to 21 as high risk for contracting meningitis, and living in close quarters like dorm rooms increases this risk. The bill now heads to the governor. For TAFP News, I'm Kate Alfano.
Here's some good news. The legislature has passed a bill supported by TAFP that would help keep Texas-trained doctors in state after completing their residency. House Bill 1380 by Representative Vicki Truitt of Keller and Senator Jose Rodriguez of El Paso would allow international medical graduates to receive a medical license after 2 years of residency training instead of 3, making it easier for them to begin working right out of residency. The bill is now on its way to the governor's desk. Believe it or not, TAFP's 2011 annual session in Scientific Assembly is just around the corner. Join us in Dallas, July 27th through the 31st, for more than 20 hours of excellent CME and a lot of fun with your colleagues. You can go online at tafp.org for more information and to register. And while we're talking about conferences, let me tell you about something exciting TAFP is working on. We're going to host a one-day interactive conference on health system reform and payment reform in Austin on October 1st. Some of the state's and the nation's foremost experts on the topic will be on hand to discuss what's on the horizon for the practice of medicine. Watch your email for TAFP's quick info for more information about this conference and to stay up to date on what happens in this last week of the Texas Legislature. For more in-depth coverage of these and other issues important to the family physicians of Texas, check out the News Update block on www.tafp.org. Thanks for watching TAFP's Capitol Report. I'm Jonathan Nelson. We'll see you next time.